Healthcare looking to request my medical records for the first time. Now, in this scenario, like many patients do, I'm going to navigate to the public website of ABC Healthcare. Once there, I find and click the section meant for patients, and I'm presented with information that helps me submit and track my records request. Now, you'll see throughout the presentation that what we're trying to achieve here is that we are a partner and we are providing seamless integration and giving the requester an experience that is great throughout this process. Now, as many other healthcare websites contain, there is a link on this website that states request medical records. However, as you see, when I get to the GRM link, there'll be no document downloaded, such as a PDF. Instead, I will be directed to GRM's request portal. And what this does is we're saving valuable time on the part of the requester through this experience. So from here, I'm going to be prompted to enter my email address, which begins the validation process right away. So after validating my email address, I am automatically directed to GRM's intelligent authorization form. So as the form is filled out, let's talk about a few things. So first, why do we use this type of form? Well, we use an intelligent form to provide a seamless and effortless experience for the requester. By giving the requester a secure online environment to fill out this form, we are essentially relieving them of any document handling responsibilities. There is no file to download, print, mail, fax, or even bring to your office. Second, how is the form built? Using Visual Vault technology, the IFORM is linked securely through API calls to our processing system. This means that when I submit the form, the system knows it was me who submitted it. It also means that any requirement for data entry is eliminated. Because the official request is created in our processing system, as soon as the user submits the form, we remove the need for data entry of the request. This also eliminates any possible human error during the data entry. So when the system loads, you can see the processor has a few simple yet powerful navigation tools. The processor can work by status or by searching for a specific ROI number, or even by patient demographic information, called acquiring charts. So what this does, it signifies the need for the processor as a workflow step to identify the records requested and begin the process to collect or acquire them. As you can see, the request we just submitted is here and ready to work on. As the processor, I can be sure that the request contains all the necessary information to take the next steps because of the intelligent form and the data transfer we talked about earlier. But the processor does still have access to the original digital request simply by clicking the tab on the top that says Digital Auths space. So in this example, let's say the provider had originally 6 EMR systems they had obtained through acquisitions and whatnot. So we already accessed a chart from the live EMR, but in this scenario, the other 5 sunsetted EMRs, all of their data was extracted and consolidated into the GRM Legacy Data Archive, where now the GRM ROI team and the provider can access this information by simply searching for patient information. And then you're presented with summary charts such as this, where we can view bookmark data or even scroll through document summaries. And we can search through the chart to ensure it matches what the processor needs from the original request. And so the processor in this case is going to go through the same steps they did on the live EMR system by printing this document to Visual Vault and entering the ROI number to associate it with that request in the ROI processing system. And so after this is complete, now we have 2 of 3 documents we need, again, all working from one system. So last, we're going to need the physical chart from 2004, 2005. And because this provider partnered with GRM for the full patient chart management solution, we know that GRM stores this file in a box in one of our secure facilities. The GRM ROI staff can simply submit a request using another intelligent form, which notifies the GRM facility to retrieve, digitize, and import the 2005 chart to the GRM ROI system. And as you'll see here, the ROI team simply needs to select the ROI number they need, which pulls the requester information from the ROI system. They then note what years the file they're looking for, and that is all they will need, because the GRM facility will know which box and where the file is located. And so again, they're going to retrieve that file, send it to their imaging center. That file will be scanned and then uploaded to the GRM ROI team, all within about a day. So in scenarios where physical charts are not stored by GRM, we can utilize similar workflows and forms to connect with the provider to obtain the chart as well. The processor is looking to match things like first name, last name, middle initial, middle name, date of birth, social security number, last four of social if provided, address, phone number, email if provided, and then of course also matching visual signatures that are found within the charts compared to the signature on the authorization form. If the processor can verify the person's identity, then they can proceed with file cleansing. If the processor cannot validate the person's identity, then the requester is notified of the need for more information, the cleansing and redaction steps. And to do this, we're just going to use a simple term. So we're going to use the patient's name and show how the ROI document viewer, again, all within this system, performs redaction and file manipulation. And what this will do is create a second layer on the document that performs the redaction. And so within the ROI system, the original document is still saved should it need to be looked at later. And here we have all the instances where the term we need to redact appears. And so the processor goes ahead and finishes the redaction automatically. GRM's audit management process. Now, as we all know, audits can come in waves, can include requests for one patient or thousands of patients. Our audit management process is built around the same methodology as our single request process, with some variations designed just for audits. Now we go to the QC review section. This is where our quality team reviews each audit throughout the process and releases the request before invoicing and delivery. So Visual Vault, once the user logs in, loads their specific profile and what they have access to. So each provider is given access to the provider portal, access through Visual Vault. And you'll see this portal includes high-level reports and dashboard data that communicates the health of your ROI program. And so for an example here, we have a simple report showing total requests received for this month to date. Then we have a pie chart that shows the separation of the types of those requests month to date. And of course, average turnaround time for the last 2 months. The provider also has access to every authorization that we receive on your behalf, and this is digital and physical requests. The provider then also has access to the processing system to be able to check the status of the single requests and navigate the system using ROI numbers or patient demographic information. And you'll see they can search and look at the same screens that the processor looked at in the processing demo. And then, as we talked about before, the provider has access to the audit management workflow to monitor the status of each audit. And you'll see the same dashboard we saw with the processor's login, except in this case, the provider has a read-only view. Each provider has the ability to import physical requests to GRM. This is done through another simple IFORM, where requests that have been received via mail, fax, or walked into the provider can be digitized and then imported right to the processing and data entry team to begin work.